Hello student, today we are going to start with the theory part, that is pharmacology and toxicology. In that, the unit first, that is introduction to the pharmacology. So let's start with the learning objectives are there. So learning objective, in that we have to understand the introduction to the pharmacology, also the scope of pharmacology. Then various routes of administration for the drug and their advantages and disadvantages are there. So after that, we are going to discuss about the absorption of the drug and the factors which are affecting to them. After that, the metabolism, distribution and excretion of drugs. So these are the learning objective. Means we have to remember that all points. Means what is the introduction of that pharmacology, means what is meant by pharmacology. There is having different branches or the different terms. So what is the scope of pharmacology? Then there is having some various routes of administration of drug with their advantages as well as disadvantages. Then there is having some process for the absorption of the drug and factor which are affecting to them. Then in that we have to understand what is meant by metabolism, distribution and excretion of that drug. So let's discuss the first point, that is introduction to and the scope of pharmacology. So in that there is having different terms for that pharmacology. So first term is pharmacology is the science of drug. Means what? In Greek word, the pharmakon, which means the drug, and the logos means the science, means the science of drug. Then also the pharmacology deals with the study of sources of drug, mechanism of action, then toxicity of the drug, then absorption, distribution and metabolism of drugs. Then pharmacology can also be defined as the study of interaction between drug and the biological system. So biological system is body. It includes the knowledge of history, sources, biochemical and physiological effects, then mechanism of action and therapeutic uses of drug. So here is having major division of that pharmacology, which is major divided into two types, that is pharmacokinetics and pharmacodynamics. So let's discuss one by one what is meant by pharmacokinetic. So pharmacokinetic, it deals with the study of absorption, distribution, metabolism and excretion of drug. Means from the entry of the drug in the body till the excretion part, that is pharmacokinetics. Means once we are going to administer any drug, from that to the excretion of that drug, means in between there is absorption, distribution, metabolism occurs. Then the study of what happens to the drug in the body, known as pharmacokinetics. Means whenever we are going to administer any kind of the drug, so what effect should be given body to that drug. So that is meant by pharmacokinetics. Vice versa, in that pharmacodynamic, just opposite the action, it deals with the study of mechanism of action and pharmacological effect of the drug. Means what happen once we will, means the body which gives the pharmacodynamic effect whenever we are going to administer any one of that drug, means how drug affects the body. So that part include in that pharmacodynamic. Then pharmacodynamic, which is known as PD, and pharmacokinetic is PK. So in pharmacodynamic, there is drug action and mechanism of action of that drug should be included in that pharmacodynamic. While in pharmacokinetics, absorption, distribution, metabolism and excretion will be occurs in different body organ parts. So there is having different kind of terms are there, like therapeutics is the term which is the branch deals with the cure of the disease and it is defined as take care of. Therapeutics means what? The take care of that patient, that is therapeutic, means which will give the relief to that patient. Then toxicology, it is the deals with the effect of poisons. Means whenever there is excessive administration of any drug, it will shows the toxicity effect. Also the method of their detection, diagnosis and treatment. Thus, this is the branch of the science if poisons are there. Then next term is pharmacy. It is the branch that deals with the preparation of the drug and the drug combination in suitable dosage form, then unblend, convenient for the administration. Then chemotherapy is there. It is the branch of pharmacology that deals with the drug capable of destroying the causative organism without destroying the host cells. Means the host cell is there, which is as it is. Without destroying them, it will cause causative organism should be there. We can use as a chemotherapy. Then pharmacopoeias are there. It is an official code containing list of selected established drug in that medical preparation with information about their physical properties, then test for their identity, purity and potency. So pharmacopoeias examples like Indian pharmacopoeia is there, British pharmacopoeia is there, and United States pharmacopoeia is there. Then there is having different sources and nature of the drugs. So these are the sources of drug with their examples like mineral, in that liquid paraffin, magnesium sulfate, magnesium trisilicate. These are the minerals. Then animals, in that the example of drug is insulin, heparin and thyroid extract. Then in plant, morphine and quinine. Then in synthetics, aspirin, sulfonamide is there. Then microorganism, penicillin, streptomycin is there. Then alkaloid, morphine and atropine is there. Then glycoside, digitalis are there. Then fixed oil, peanut oil, coconut oil. Then volatile oils, the example of drug is oil of eucalyptus, ginger oil, peppermint oil. Then gums, example of drug is agar. Then in tannins, tincture, catechu is there. So next part is routes of administration of that drug with their advantages and disadvantages. Means whenever we are using any of that route, like oral route, parental route is there. So there is having some kind of advantages as well as disadvantages. So this is the flowchart of route of administration. In that enteral or parenteral and local application. So the routes are divided into three main routes like enteral, parenteral and local applications. So enteral in that again subdivided into oral, sublingual and enema. And in parenteral there is injections like intradermal, subcutaneous, intramuscular, intravenous, intraarterial, intrathecal, intramedullary, intraarticular. So these are the different types of injections are there. Then inhalation is there. Second, parental route. So let's discuss one by one route. So enteral, the term enteral is derived from the word enteron, meaning of intestine. In this case, the drug is directly placed into the GI tract. Means enteral route, what happened? There is drug directly placed to the GI tract. So it is mainly having three routes of administration like oral route, sublingual and enema. So oral route, it is the most preferable route of administration. The dosage form is placed in a mouth cavity and swallowed from the mouth cavity. And after the administration by this route, the absorption takes place in intestine. So the advantages of oral route: safe, more convenient, economic. Then it does not need any assistant. It can be a self-medication. Means we can do the self-medication in that oral route. So suitable for both solid and liquid dosage form like powder, capsule, tablets, liquid like syrup, emulsion, mixture is there. Like disadvantages are there. Action of the drug is slow and thus not suitable for emergencies. Like in intravenous route, they are showing high quick action, right? So in oral route, it will require time to dissolve or absorb. So the onset of action is slow Unpalatable drug and irritant drugs cannot be given by this route. Means there is some irritant drug are there, so it may causes the nausea as well as vomiting. It cannot be used for uncooperative, unconscious vomiting patients. So these are the advantages and disadvantages of that route. Next is what is meant by first pass effect. So first pass effect is the term used for the hepatic metabolism of the pharmacological agent when it is absorbed from the gut and delivered to the liver via portal circulation. Then the greater of that first pass effect, the less the agent will reach to the systemic circulation when the agent is administered orally. So first pass effect means what? When the hepatic metabolism process is there. So once we are going to administer any drug which will be absorbed in the GI tract, GIT, and delivered to the liver via the circulation. Means portal circulation is applied there. So which is known as first pass effect. So next is sublingual route. Sublingual route means what? The drug or the palate containing the drug is placed under the tongue or crushed in the mouth in order to spread it over the buccal mucosa. The only lipid soluble non-irritant drugs can be administered by this route of the drug administration. The example of that sublingual drugs are there: nitroglycerin, clonidine, isoprenaline, nifedipine, methyl testosterone there. So these are the drugs for that we can use. Okay, so next is there are some having some kind of advantages are there, like relatively rapid absorption is there, quick onset of action is there, drug can be spitted after the desirable effect, then liver is bypassed, so the drug with high first pass metabolism can be absorbed directly into the systemic circulation. Then disadvantages are there, unpalatable and bitter drugs are difficult to be administered. Then irritation of the oral mucosa can be occur. Then drugs are not given in large quantity. Few drugs are absorbed in this case. So this is a example of that drug. So next route is rectal route. In that, for the systemic effect, the drug can be put into the rectum and they are used as a supplementary suppositories or retention of enema. So example is aminophylline is there, diazepam, indomethacin we can use as a rectal drug. So types of enema like evacuant is there and retection. So what is mean by evacuant? The maximum quantity of fluid administered at the time is about 600 ml, and as it evacuates in the bowel, it is termed as evacuate enema. So example is soap water in rectum. Then retention, thus the medicaments acts locally as a prednisolone. Enema is ulcerative colitis. Sometimes the drug may act systematically by the absorption through the mucous membrane. So paraaldehyde enema for the production of basal anesthesia we can use. So these are the some examples. So there is having some disadvantages and advantages of that route. So the advantages are certain irritant and unpleasant drug can be given by this route. Then this route can be used as in presence of recurrent vomiting. So in their patients having some kind of recurrent vomiting is there. So this route can be more convenient. So disadvantages are inconvenient and embarrassing. Then absorption is slow, irregular, and often unpredictable is there. Then irritant drug may causes the inflammation. So some are having the irritant property which may cause the inflammation by this route. So next is parental route. Per means what? That is beyond. Enteral means intestine. Beyond that, intestinal. So the parenteral refer to the administered by the injection, which takes the drug directly into the tissue fluid or the blood without having to cross the enteral mucosa. So there is having some advantages like drug action is faster. In emergency condition, we are use that in the parenteral route. Then gastric irritant and vomiting are not provoked. Then parenteral route can be employed even in unconscious, uncooperative or vomiting patient. Then there is no chances of interference by the food or the digestive juices. Then liver is bypassed. Then the disadvantages are the preparation has to be sterilized and is costlier. So whatever preparation we are going to use, make sure that the preparation should be sterilized with their terms and conditions. So it will require, so it will be costlier. So the technique is invasive and painful because we are going to use the injections. So that's why it will be painful. Assistant of another person is mostly needed because we cannot do the self-medication in that condition. So through the self-medication, only one case is possible, like insulin by diabetes. Means the patient having the diabetes, they can use that means self-medication can be done by for that use of insulin. So there are chances of local tissue injury and in general or parenteral route is more risky than the oral route. So next is injections are there like intradermal, intramuscular, subcutaneous, intravenous, intramedullary, intrathecal, intraarterial, intraarticular. So these are the different types of injections are there. So let's talk about one by one intradermal injections. So intradermal means what? The drug is injected into the skin, raising the bulb or scarring or multiple puncture of the epidermis through the drop of the drug is done. So this route is employed for the specific purpose only. Means injection is made by this upper layer of the skin of the dermis. So look into that figure. That is there is the layer of the skin that is epidermis, dermis, subcutaneous tissue is there and muscles are there. So in intradermal, we are injected into that skin like in dermis, we are injected with injections. The amount of drug is given in small and absorption is slow. The common method is used for allergy testing and sensitivity testing. So example of BCG vaccines. Then the injections are the best made with the fine short needle and small barrel syringe. So advantages are absorption is slow. This is an advantage in testing for allergies. There is disadvantages are there. Small amount of drugs are injected, may be painful. So these are the disadvantages. The next is intramuscular. So there is different layer of that skin. Then subcutaneous tissue is there and muscle is there. So the drug is injected in the layer of muscle tissue that is deltoid, which is present in our shoulder joint, triceps, also the gluteus maximum and femoris. So gluteus maximum is the muscle of the hip. Then rectus femoris is there. So there we can injected that intramuscular drug. So made with a longer and heavier needle that penetrates the subcutaneous tissue and allows the deposition of the drug deep between the layer of muscle mass. Then the drug in the layer of that muscle mass forms the tissue deposit and releases the drug slowly, providing the prolonged action. So advantages in that muscles is less richly supplied with sensory nerve, so the mild irritant can be injected. It is less painful. Oily solution, aqueous suspension can be injected by this route. Then the rapid onset of action should first pass avoided. Gastric factors can be avoided by this route. Then disadvantages are local pain and abscess. Then expensive infection may be caused. Then nerve damage. Self-injection is often impracticable because of deep penetration is needed. So these are the advantages. Then next is subcutaneous route is there. The drug is deposited in a loose connective tissue. Subcutaneous tissue is under the skin. See, the skin, subcutaneous, just below that muscles is there. So usually soluble drugs are given by this route. So the site of action is outer surface of upper arms or in front of thigh, that is up to 2 mm. An example of that route is adrenaline, morphine, insulin. Advantages of that route: absorption is slow, so the action is immediate and prolonged. Then self-injection possible because the deep penetration is needed. Then depot or the respiratory repository preparations that are aqueous suspension can be injected for the prolonged action. So the disadvantages are absorption is slow than the intramuscular. Then only small volume can be injected. Then this route should be avoided in shock patient who are vasoconstricted. Means absorption will be delayed because of that. Next is intravenous injection is there. Medications of the fluids are administered directly into the bloodstream or vein and immediately available for the use of body. So the IV route is used when very rapid onset of action is desirable. It requires the skill and sterile assist, and the drug must be highly soluble and be capable of withstanding sterilization. Then IV route is great value in emergency. Means while in our oral route, we cannot use it in emergency because it will show the slow absorption. Due to that slow absorption, so every process will be slow. Means there is a prolonged action will be required. But in IV route, by using of that IV route, this is the advantages. It can be used in emergency condition, which is useful for administration of irritant and hypotonic solutions. Not suitable for the drug with the oily vehicles or those precipitating blood constituent. So advantages are rapid onset of action, means less than 15 seconds it will shows the reaction. Then the entire injected dose almost instantly available since it bypasses the gastrointestinal tract and first pass metabolism. Then allows the injection in large quantity, thus used in saline. Then a lower dose is administered than if the drug is given orally. The administration is useful for the drug that are irritant when administered intramuscularly. So there is having some kind of disadvantages are there, like break skin barrier, limited to the highly soluble drug, then drug absorption inhibited by the poor circulation, then drug has to be administered by trained person only, then termination of the therapy is difficult, then accidental overdose can be having serious consciousness. So types of injections like intramuscular, subcutaneous, intravenous, intradermal. So these are the types of injections. So intraarterial injection is there. Intraarterial, the drug is injected directly into the artery and this leads to the localization of the drug effect in the particular organ or tissue. Suitable for the antineoplastic drug, diagnostic study and anti-malignancy drug, then used for the only experts and trained person can be used. Then sudden injection of the drug in arterial blood flow may causes the damage to the tissue and locally or may be fatal for the tissue. So this is all about the intraarterial injection. Then intrathecal, the drug to be injected in subarachnoid space so that it reaches to the CSF, that is cerebrospinal fluid, for the CNS action and used for the local and rapid effect of the drug. So example is spinal anesthetics, antibiotics, corticosteroids are there. So there is having some kind of advantages like drugs for long duration surgery, then to prevent the complication from the general anesthesia, then direct or rapid action, then limitation is strict aseptic condition are required. So intramedullary injection is there. When the IV is not visible, the drug is directly placed into the bone marrow. So there is a means offers the very rapid onset of action after that IV. Means we after that IV, the intramedullary injection should be used. So used for the implant and restless patient when the veins are blocked or useless for the circulation due to thrombosis or circulatory damage. So in that cardiac arrest also we can use in intramedullary injections. Then in adult, the drug is inserted via the sternum, and in infant, it will be the tibia and femur there. So the limitations are there, disadvantages are there, needs train and specialized skill and needs sterilization. Intraarticular route is there or intraarticular injection is there. So injecting drug directly into the joints to achieve the higher local concentration of drug. So example is hydrocortisone acetate is given by this route for the treatment of rheumatoid arthritis. So limitations of that route, drugs has to be sterilized and specialized skills are required. Inhalation, the drugs are administered either in gaseous or volatile agents like aerosol form, and the certain drugs can be given by the form of the spray. Then adrenaline spray in the treatment of asthma. Also the salbutamol spray we can use in the treatment of asthma. So advantages, large surface area is required, fast local and systematic effects of the drug, then severe as a local route in the lung diseases, then high blood flow, hepatic phosphate metabolism is avoided. Thus the concentration of volatile substances like anesthetics can be controlled. And the small dose seems to be directly derived by the less toxicity as the result of that rapid onset of action due to the rapid access to the circulation. So the disadvantages of that route, as the drug directly enters in a left side of heart, so the danger of the cardiac toxicity is there. So the drug producing local toxicity may increase the secretion in respiratory tract. And the special technical skills and specially designed apparatus is essential. Then there is local route. In that, drug can be effectively delivered to the localized lesions on the skin, oropharyngeal, nasal mucosa, eye, ear, anal canal, or vagina in the form of lotion, ointment, cream, powder, rinse, paint, drops, spray, lozenges, suppositories, or pessaries. So the local route will be used by the local applications. So some of these are given below, like mouth and pharynx as a paint, gargle, lozenges, mouthwashes are there. So in eye or ear or nose, there is irrigation or sprays are there. So gastrointestinal tract, non-absorbable drugs given orally. Bronchi and the lungs, inhaler, that is aerosol is there. Then in urethra, jelly or irrigating solution is there. And for vagina, the tablet insert, then cream powder dodges are there. Anal canal, ointments are there. The non-absorbable drugs given orally for the action of mucosa like vancomycin and sucralfate. So these are the example. Then inhalation of drug for the action of bronchi, that is salbutamol and cromolyn sodium. And the irrigating solution or jelly, povidone iodine, lidocaine applied to the urethra or other forms of topical application. So this is all about the routes of administrations. Thank you.